You look at your blood test results, see those numbers, AST, ALT, and your heart sinks. Your doctor said they were elevated, that you need to take care of your liver, but didn't really explain what each one means, which one is more serious, if you're in immediate danger, or if there's still time to turn things around. You leave the office with more questions than answers. That weight of guilt on your conscience, wondering if you should have done things differently years ago, if you should have taken better care of your health when you still had time. Then comes the insomnia, the fear of telling your family, that feeling of powerlessness, like your body's betraying you and you don't even know where to start fixing it. You search online and find a ton of confusing information. Some say AST is worse, others say ALT is the villain. You read about cirrhosis, about transplants, about people who lost everything because of their liver. And the despair only grows. But what if I told you there's a crucial difference between these two tests? A difference that can completely change how you approach your health starting today, and that most doctors don't have the time to explain in their office. What if I showed you that understanding which of these tests matters most to you could be the key to reversing fatty liver before it's too late? I've been seeing patients for over 20 years, and many of them come into my office with the same look of distress that you might be wearing right now watching this video. They bring in abnormal test results, fatty livers, and the first question is always the same. Doctor, which of these numbers should I be more worried about, the AST or the ALT? And the answer isn't as simple as it seems, because each of these tests tells a different story about what's happening inside your liver at this exact moment. A recent study in the scientific journal Hepatology showed that over 60% of patients with fatty liver disease don't know how to correctly interpret their results. And this is leading thousands of people to treat the wrong problem, to focus on the wrong enzyme, while their liver continues to deteriorate silently. This concerns me deeply because I see the consequences of this lack of information in my practice. I see people who could have reversed their condition years ago, but lost precious time because no one properly explained what those numbers meant. If you've made it this far, it's because you don't want to be just another statistic. You want to understand what's happening with your body. You want to take back control of your health. And that's precisely why I created this channel, for people like you who aren't satisfied with vague answers, who want real science-based information explained in a way that makes sense to someone who isn't a doctor. Every week, I bring you updated content on fatty liver, on how to reverse it, on what truly works and what's just a waste of time. This is information I learned from the latest research, and that many colleagues either don't know yet or don't have the time to pass on to their patients. Subscribe to the channel now and hit the notification bell, because in the upcoming videos, I'll show you complete, step-by-step protocols to restore your liver health and live without fear again. You deserve to have this information. You deserve someone who explains things to you with clarity and respect, and I'm here for that. Don't leave your liver to chance. Come with me on this journey. Now, before I reveal which of these tests matters most, I need to tell you the story of Mrs. Mariana, a 68-year-old woman who came to my office 3 months ago completely lost. She had routine exams, and her ALT was 120, almost triple the normal range, while her AST was 80, also elevated, but not as much. The doctor who ordered the tests told her to come back in 3 months and repeat them, but didn't explain anything, didn't say what it meant, didn't recommend a diet, nothing. Mariana spent those 3 months in terrible anguish, waking up in the middle of the night with her heart pounding, thinking she was going to die, that her liver would just stop working. She stopped going out, stopped seeing her friends, fell into a depression because she thought she had a serious, incurable illness. When she sat in front of me and started crying, saying she was afraid she wouldn't see her grandchildren grow up, I felt a surge of indignation because all that suffering was unnecessary. It could have been avoided with 15 minutes of explanation and proper treatment. I took Mariana's test results and started explaining what each number meant. The ALT, which was the enzyme most elevated in her case, is concentrated mainly within the liver cells. It's an enzyme that lives there, quietly doing its job of helping the liver metabolize proteins and produce energy. When ALT is high in the blood, it means liver cells are being destroyed, rupturing and releasing this enzyme into the bloodstream, like soldiers fleeing a burning barracks. And in the case of fatty liver, which is exactly what Mariana had, ALT is the first to rise, because fat builds up inside the cells, swelling them, putting pressure on them until the membranes start to rupture, and the enzyme leaks out. AST, which was also high but less so, is present not only in the liver, but also in the heart, muscles, and kidneys. So when it rises on its own, without ALT rising with it, it can be a sign of problems in other organs, not necessarily the liver. So I asked Mariana, "Did you have an ultrasound of your liver?" She said yes, and the results showed grade 2 hepatic steatosis, meaning moderate fatty liver. Then I explained, "Look, Mariana, in your case, ALT is the test that matters most, because it's telling you that your liver cells are suffering right now, at this moment, because of the fat. The AST is also high because when the liver is very inflamed, it ends up releasing AST too, but the origin of the problem is in the liver cells, so ALT is where we need to focus." And you know what happened? In 2 months of a proper diet, light exercise, and some lifestyle adjustments, Mariana's ALT dropped to 60, almost half of what it was, and she started smiling again, regained hope, and began to believe she could recover her health. She told me at her last appointment, "Doctor, if someone had explained this to me 3 months ago, I wouldn't have suffered so much. I wouldn't have lost sleep for nothing." Now, I need to ask you a question, and I want you to be completely honest with me here in the comments, because your answer could light the way for thousands of people watching this video right now who are feeling exactly like you. When you got your exam results and saw your AST and ALT levels were off, what was the first thought that popped into your head? Was it fear of dying? Was it guilt for not taking better care of your health? Was it that feeling of loneliness, of facing this alone, with no one to really explain what's happening? I know it's hard to admit these feelings. I know you're afraid of being judged, of people thinking you don't take care of yourself, that you lack willpower. But I need you to know that you're not alone, that thousands of people go through this every day, and that it's not your fault. It's a medical condition that has treatment. It has a solution. So I want you to comment below. You can use these words if you like. "I have fatty liver and need help." Don't be ashamed. Don't hide behind silence, because when you comment, you're creating a support network. You're showing other people that they're not alone in this fight. And I read all the comments. I reply, "I'm here with you. Your story matters. Your fight matters. And together, we will win this battle." Comment now. Getting back to the exams, there's something I need to explain very clearly, because it can completely change how you interpret your results. There's a relationship between AST and ALT that hepatologists use to understand what's causing the liver damage. When ALT is higher than AST, we're usually talking about fatty liver, viral hepatitis, side effects of medication, things that directly affect liver cells. But when AST is much higher than ALT, then we think about alcoholic liver disease, because alcohol damages cells in a different way, releasing more AST than ALT. So if you drink a lot and your AST is twice as high as your ALT, that's a major red flag, because it means alcohol is destroying your liver at an accelerated rate. I had a patient, I'll call him Robert, 55 years old, who came in with AST at 200 and ALT at 80. He swore he didn't drink, said he only had a little beer on the weekend, but that relationship between his labs was screaming that alcohol was involved. I sat with him, looked him in the eye, and said, "Robert, I'm not here to judge you. I'm here to help you. But I need you to be honest with me. How much do you really drink?" And then he broke down, started crying, and confessed that he was drinking every day. hiding it from his family because he'd lost his job and was depressed. That was a turning point in his life, because from then on, he agreed to treatment, stopped drinking, started therapy, and in 6 months, his AST dropped to 50. His liver was recovering. The cells were regenerating because the liver has this incredible capacity to heal when you stop harming it. But there are also cases where both AST and ALT are high, and then things get a bit more complicated because it can mean you have more than one problem happening at the same time. It could be fatty liver along with a medication you're taking that's bad for your liver. It could be fatty liver along with hepatitis B or C that you didn't even know you had. It could be a combination of factors. In these cases, we need to investigate further, order more tests, do an ultrasound with elastography to see if there is already fibrosis, sometimes even a biopsy if the case is severe. But the important thing is not to panic, because most of the time, when we identify the cause and treat it properly, the liver responds very well. Now let's talk concrete numbers, because I know you want to know exactly what's considered normal and what's concerning. The normal ALT level for men is up to 41, for women up to 33, but these values can vary slightly from lab to lab. If your ALT is between 45 and 100, we consider it a mild elevation, usually caused by early-stage fatty liver, medications, or even intense exercise in the days before the test. If it's between 100 and 300, that's a moderate to severe elevation, indicating a significant inflammation is happening, and you need to investigate the cause urgently. Above 300, we're talking about acute liver injury, something that needs immediate medical attention. It could be acute viral hepatitis, medication intoxication, or some serious condition that's rapidly destroying the liver. AST follows similar values, but as I've explained, it's not as specific to the liver as ALT. Some people do heavy weightlifting, and their AST goes up because muscles release this enzyme when you train very hard. So if you work out a lot and your AST is a bit high, but your ALT is normal, it's probably nothing with your liver. It's just the effect of the workout. But if both are high, then yes, we need to look at the liver with attention. I had a patient, Mrs. Clara, 62 years old, who had ALT at 90 and AST at 70. She was extremely worried, thinking she'd need a transplant, that her life was over. When I looked at her whole picture, I saw she had obesity, uncontrolled type 2 diabetes, high cholesterol, sky-high triglycerides. In other words, a complete metabolic syndrome. Her liver was full of fat, and that fat was causing inflammation, which is what we call non-alcoholic steatohepatitis, or NASH. I explained to her that the high ALT was precisely a reflection of this inflammation. Her liver cells were swollen with fat and starting to die. But I also explained that this had a solution, that it wasn't a death sentence, and that with the right changes, she could completely reverse the condition. We put together a plan for Clara that included a diet with reduced refined carbohydrates, increased lean proteins, and healthy fats, light aerobic exercise 5 times a week, starting with just 20 minutes and gradually increasing strict control of blood sugar and cholesterol, and supplementation with vitamin E and omega-3, which have scientific evidence of helping with fatty liver. In 4 months, Clara had lost 26 pounds. Her ALT dropped to 45, almost at the upper limit of normal, and she was radiant, full of energy, without that chronic fatigue she had before. She told me she felt 20 years younger, that she had started going for walks with her friends again, that she was sleeping better, that life had started making sense again. And you know why I tell you these stories? Because I want you to understand that no matter how high your test scores are right now, no matter if the doctor scared you saying it's serious, the liver has a capacity for regeneration that borders on the miraculous. If you stop harming it, if you give it the right conditions, it will recover. It will get back to functioning properly. The enzymes will drop. The fat will disappear. But for that, you need to act. You need to make the decision today that you're going to change, that you're going to take care of yourself the way you deserve. Now, there's a question I get asked a lot. Doctor, what if my AST and ALT are normal, but the ultrasound showed fatty liver? Is that possible? The answer is yes, it's perfectly possible, and in fact, it happens very frequently. You can have early-stage hepatic steatosis, where there's already fat accumulated in the cells, but not enough inflammation yet to break through the cell membranes and release the enzymes into your blood. In these cases, the ultrasound can already see the fat, but your blood tests are still normal. Is this good or bad? It's good in the sense that you caught the problem early before there was cell damage, so you have a much better chance of a complete reversal. But it's bad in the sense that many people think if their tests are normal, they don't need to do anything. And then the condition continues to progress silently until a few years down the line, the enzymes start to rise, and then it's much harder to reverse. That's why I always say, your ultrasound is your best friend when it comes to fatty liver, because it shows the fat before the blood tests do. If you have risk factors like obesity, diabetes, high cholesterol, high blood pressure, you should get an abdominal ultrasound at least once a year, even if your blood tests are normal. And if the ultrasound shows fat, don't wait for the enzymes to climb to start treatment. Start treating it immediately, because prevention is always easier than cure. There's also the issue of GGT, which is another enzyme that appears on tests along with AST and ALT. GGT is located in the bile ducts, those little channels that carry bile from the liver to the intestines. When GGT is high, it can indicate an obstruction in these ducts. It could be gallstones, inflammation, or even a tumor in more serious cases. But GGT also spikes significantly with alcohol. So if you drink and your GGT is high along with AST, it further reinforces the suspicion of alcoholic liver disease. And some people take medications for seizures, for sleep, for anxiety, and these medications can also cause GGT to rise. So it's always important to give your doctor a complete list of everything you take, including supplements and natural products, because many people think natural means harmless and end up taking things that overload their liver. I had a patient who was taking a weight loss tea bought online, and his GGT shot up to 300, his ALT to 150. He developed jaundice, turning yellow, and had to be hospitalized. When we investigated, we discovered that the tea contained hepatotoxic substances that were literally poisoning his liver. After he stopped taking it, within a few weeks, his enzymes started to drop, but he was incredibly shaken. He nearly had acute liver failure because of a product he thought was harmless. So here's a very important message. Never ever take anything for weight loss, muscle gain, sexual performance enhancement, or anything like that without first consulting a doctor and getting tests to see how your liver is doing. The market is full of miracle products that promise quick results but silently destroy your liver, and by the time you realize it, it's too late. Your liver is far too precious to risk for the promise of losing 20 pounds in a month. Getting back to the tests, there's a technical detail I need to explain. The difference between acute and chronic liver injury. When enzymes rise sharply and suddenly, we call it acute injury. It could be a viral hepatitis you just contracted, a medication overdose, or ischemia, which is when the liver doesn't receive enough blood for some reason. In these cases, AST can reach thousands, like 3, or 5, and the person feels very ill with nausea, vomiting, abdominal pain, jaundice. It's a medical emergency that requires immediate hospitalization. Chronic injury, on the other hand, is when enzymes are elevated for months or years, but they don't rise that high. They stay around 100, 150, sometimes fluctuating a bit up or down. This is typical of fatty liver, chronic viral hepatitis, or chronic alcohol use, and it causes damage to the liver bit by bit, day after day, until it can eventually lead to fibrosis, then cirrhosis, if left untreated. Fibrosis is when the liver starts to develop scar tissue in place of the dead cells. like a burn scar on your skin, but inside the liver. In the beginning, fibrosis is reversible. If you stop harming the liver, the scars can disappear. But if you continue to harm it, keep drinking, keep eating poorly, keep accumulating fat, there comes a point where fibrosis turns into cirrhosis, and then there's no going back. The damage is done. That's why it's so important to address elevated enzymes now, before it turns into cirrhosis. Because once it's cirrhosis, the most we can do is slow its progression, but we can't reverse it completely anymore. And how do we know if there's already fibrosis? There are some non-invasive tests that help a lot. The most common is FibroScan, a device that measures liver stiffness using sound waves similar to an ultrasound but more specific. If the liver is soft and flexible, it means there's no fibrosis. If it's hard and rigid, it means there are scars, there's fibrosis. It's a quick, painless exam that gives you an immediate result. There are also blood tests like FIB4, which calculates a fibrosis score based on certain variables in your blood, but it's not as precise as FibroScan. And in doubtful cases, or when we need absolute certainty about the degree of damage, we perform a liver biopsy, where the doctor takes a small piece of liver with a needle and sends it for microscopic analysis. Biopsy is the gold standard, the most reliable test, but obviously it's invasive and has risks, so we only do it when absolutely necessary. I need you to understand something very important. If you have fatty liver disease and your ALT levels are high, you're in a window of opportunity right now, at this very moment, to reverse it before it turns into something worse. Don't put it off until tomorrow. Don't think you can wait a little longer, because every day that passes with an inflamed liver is another day of damage, more cells dying, more fibrosis forming. Start today, right now, making the changes you need to make. Cut out refined carbs, cut out sugar, cut out fried foods, cut out alcohol if you drink. Start walking, even if it's just 15 minutes a day, but start. Drink more water, sleep better, manage your stress. And follow up with your doctor diligently. Repeat your tests every 3 months to see if you're improving, and adjust your treatment as needed. Some people ask me, "Doctor, but I've tried to lose weight so many times, and I haven't succeeded. I've been on a ton of diets, and I always gain the weight back. How am I going to reverse fatty liver if I can't even lose weight?" And I answer, look, reversing fatty liver isn't the same as losing weight to fit into a smaller pair of jeans. It's a matter of health, of survival, of being able to see your children and grandchildren grow up. And the great news is, you don't need to lose 30 pounds all at once. Studies show that losing just 7 to 10% of your body weight is enough to significantly reduce liver fat and improve your enzyme levels. So if you weigh 220 pounds, losing about 15 to 22 pounds makes a huge difference. And losing 15 pounds over 6 months is totally doable. That's a little over a pound a month, a realistic goal you can achieve with small but consistent daily changes. I've seen patients completely reverse their fatty liver in a year. They went from severe fatty liver, grade 3, to a normal liver. Their enzymes returned to normal, and they didn't have any bariatric surgery or take any miracle drugs. They just did the basics well: a balanced diet, regular exercise, adequate sleep, and stress management. It sounds simple, and in a way it is simple, but it's not easy. It requires discipline. It requires you to change lifelong habits. It requires you to confront the emotions that lead you to overeat, overdrink, and self-sabotage. That's why it's often important to have multidisciplinary support with a nutritionist, a psychologist, and a physical trainer in addition to your doctor, because you're making a complete life change, not just taking a pill and being done with it. And about medications, some people ask, "Doctor, isn't there a pill for fatty liver?" The truth is, there isn't a medication specifically approved to treat non-alcoholic fatty liver disease yet, but several promising medications are in clinical trials. In the meantime, we sometimes use medications off-label, which are drugs approved for other conditions that have shown benefits for fatty liver as well. High-dose vitamin E, for example, has studies showing it reduces liver inflammation in patients with NASH, but it should only be used under medical supervision because in excess it can have side effects. Pioglitazone, a diabetes medication, has also shown benefits in some studies, but again, only with a prescription. And then there are the GLP-1 receptor agonists, the newer diabetes and obesity drugs like semaglutide and liraglutide, which are showing very good results in reducing liver fat, in addition to helping with weight loss and blood sugar control. But no medication works miracles on its own. It can help, yes. It can speed up the process. But if you continue to eat poorly and live a sedentary lifestyle, it won't make a difference. Treating fatty liver is multifactorial. You need to attack the problem from multiple angles simultaneously, and the most important of all remains lifestyle change. I know you're tired of hearing this. I know it sounds like a broken record, but it's the truth, proven by science. There are no shortcuts, no magic bullets. Now let's talk about something practical you can do today, right after you finish watching this video. Grab your most recent lab results, write down your AST, also known as SGOT, ALT, also known as SGPT, and GGT values, and compare them to the lab's reference ranges. If they're elevated, note how long they've been elevated. Was it just a one-time test, or have they been high for months or years? Then, get your last abdominal ultrasound, if you have one, and see if it mentions hepatic steatosis and at what grade. With this information in hand, you'll have a better idea of the severity of your condition and the urgency of starting treatment. If you've never had an abdominal ultrasound and have risk factors, schedule one as soon as possible. Because, as I've explained, it can show liver fat even before blood tests do. And comment below with your AST and ALT values. Let's create a chain of information and support, where one person helps another, where you feel part of a community fighting for health together. If you have fatty liver and you've watched this video this far, please hit that like button now. It shows me that this content is reaching the right people who genuinely want to make a change, and it motivates me to keep bringing you quality information every week. And if you know someone who has fatty liver, who has abnormal test results, who is suffering and doesn't know what to do, share this video with them. Because information saves lives, information changes destinies, and you can be an instrument of transformation in the life of someone you love. Let's recap the main points of this video to really nail them down. First, ALT, also known as SGPT, is the most liver-specific enzyme. When it's elevated, it means your liver cells are being damaged, and in cases of fatty liver disease, it's usually the first to show changes and the most important one to monitor. Second, AST, also known as SGOT, isn't as liver-specific. It can be high due to muscle or heart issues. However, when it's significantly elevated along with ALT, especially if AST is higher than ALT, it points towards alcoholic liver disease. Third, ALT levels between 45 and 100 indicate mild injury. Between 100 and 300 suggest moderate to severe injury, and anything above 300 signifies severe acute injury requiring urgent medical attention. Fourth, you can have fatty liver disease even with normal enzyme levels, which is why an ultrasound is crucial. Fifth, GGT increases with alcohol consumption, certain medications, and bile duct obstruction. So it always needs to be evaluated within the overall clinical picture. Sixth, fibrosis can be detected with a fibroscan or other non-invasive tests, and it's important to know if you have fibrosis to determine the urgency and intensity of treatment. Seventh, reversing fatty liver disease is possible. It's real, and thousands of people achieve it, but it demands consistent lifestyle changes. There are no shortcuts. And eighth, regular medical follow-ups with repeat tests every 3 months are essential to see if the treatment is working and to make adjustments as needed. I truly hope this video has clarified your doubts about AST and ALT, and most importantly, that it has given you hope that you can indeed reverse fatty liver disease, regain your health, and live without fear. Don't let the numbers on your lab results get you down, and don't let fear paralyze you. Use that fear as fuel for change, for action. Your liver is crying out for help. It's sending signals through these altered enzymes, and now you know how to decipher those signals, you know what they mean, and you know what you need to do. Don't ignore it any longer. Don't put it off. Start taking care of yourself today, just as you deserve, just as the people who love you deserve to see you healthy and happy. In the next video, I'll show you a complete step-by-step protocol on how to create a specific diet to reverse fatty liver disease, which foods to prioritize, which to avoid, how to distribute meals throughout the day, and how much protein, carbohydrates, and fat you should be eating. It'll be a practical guide you can print and put on your fridge so you'll have no more excuses about not knowing what to eat. So, subscribe to the channel if you haven't already, hit that notification bell so you don't miss out, and I'll see you in the next video. Take care of yourself. You're important. Your life has value, and I'm here rooting for you.